Hey, welcome back to Paramedic Project, and thanks for joining us once again today. Final episode on the sepsis patient. I want to cover two important points. First of all, why do we miss these patients? Here's my theory. We as paramedics are trained to identify sick patients, patients who are peripherally shut down, patients who are pale, cool, clammy. That is the typically sick looking patient to us. And in the first few seconds of patient contact, when we walk through that door and we see a sick patient, this really heightens our senses. We identify them as sick, and we then subsequently really do a thorough assessment on these patients and go hunting for the problem. Sepsis patients, especially those ones with elements of distributive shock in their clinical presentation, just don't present in the same way. They're not pale and they've got warm peripheries because of the distributive shock. So that is a very, very important point. They don't have the same clinical presentation, and that means we have to be even more careful and more vigilant about our clinical assessments of the patient. So that's the first big point. Second big point is on treatment of these patients. Treatment of these patients, the sepsis patient, really centers on early access to fluid administration in the pre-hospital environment. And they don't, once again, they don't behave like normal people, normal patients will. Normally a patient with systolic blood pressure of 90, we give them a fluid bolus of 250 to 500 mils, their blood pressure really improves. It goes up, it stays above 100. These patients do not behave that way. We give them a fluid bolus, their blood pressure transiently improves, and then due to the distributive shock, it then comes down, they become hypertensive again. We need to do regular reassessments of these patients. We need to treat them appropriately, and we may need to give them continued fluid boluses in our pre-hospital care just so that they get some improved perfusion. They're the two big points. They don't look the same clinically, and subsequently we don't care for them in the same manner as other patients either. So in Paramedic Project, thanks for joining us once again. Find us on social media, and we'll see you next time.